Thanks so much for staying with us. We are talking about Breast Cancer Awareness Month being in October. 1 in 8 women will be diagnosed with the disease, but we know early detection saves lives. So this month is also a great reminder for those 40 and up to schedule their mammogram.
Joining us this morning to talk about when to do that and everything else we need to know about breast cancer is Dr. Kelly Cronin. She is a radiologist and the medical director of breast imaging at Atrium Health Wake Forest Baptist.
Thank you so much for joining us. She's also a clinical associate professor of radiology at Wake Forest University School of Medicine, so certainly the person to be speaking with. Doctor, we first want to ask you what the warning signs of breast cancer are.
Well, good morning, and thank you so much for having me. We love October because it's a good chance to promote awareness about breast cancer. And a lot of patients and people are aware that if you feel a lump or any changes on your physical exam in the breast, that it's a sign that something could be going on. But there's other things that can happen. Any sort of changes in the nipple, whether it be discharge or scaling or redness at the nipple. You can have lumps under your arm. You can have changes in the skin. And then one last one is pain. It can be a little trickier because breast pain with your menstrual cycle can be very normal. But if you have pain that stays in a particular spot and doesn't go away, or a tugging sensation, those are some of the less common signs we see patients with breast cancer present with.
And Dr. Cronin, how common is breast cancer? We talked a little bit about those statistics off the top, but are they growing? What are you seeing?
Yeah, so unfortunately it is very common. It's the second most common cancer we see in women. It's 1 in 8 women will be diagnosed with breast cancer in their lifetime. And it's not just women, actually. 1 in 800 men will also be diagnosed with breast cancer. So then if you're watching, pay attention, tune in, you are not immune. So pay attention to your self-exam as well.
And obviously we mentioned early detection is key here in fighting this disease. When people hear early detection, can you put that into kind of a tangible way of knowing what that means? You said, at home breast exams, mammograms. What else though can we do to early detect?
So one important thing is to know your family history, because almost all the societies agree now that screening at 40 and every year is the best way to detect breast cancers early, and that's really important. But doing your monthly self-exams in between those yearly mammograms. But going back to the family history, if you do have a family history, sometimes we'll recommend that you actually start getting screened earlier than 40. So it's really important. It'd be really helpful to tell your provider if you do have that strong history.
And doctor, are there any ways to help prevent breast cancer at all?
So there are some things, and they're actually really easy to remember because it's just sort of general wellness. You want to be active, getting about 150 minutes of activity a week. You want to maintain a healthy weight, and the last thing we talk about is alcohol intake and trying to minimize that, because that has been linked to a higher risk of breast cancer. So all just sort of general things to be healthy that we all know we should be doing.
What about tips for women scheduling their first mammogram if there's nerves or fear, kind of uncertainty of what to expect? Do you have any advice?
Yeah, so I think a lot of people were unsure. I know when I had my first mammogram, even though I worked there, I didn't quite know what to expect. But the first thing to know is it's minimal to no pain. They do put your breast in compression, but that compression is very quick. And we have really excellent technologists who are really good at putting you at ease and telling you exactly what to expect when you have it. So they make it quick and easy. The whole exam takes about 10 to 15 minutes, and then you're out of there.
Oh, and we have those tips on the screen now for folks too to take a look at once again. You mentioned family history, and I actually went through genetic testing last year because it is in my family, cancer on both sides. The process was really seamless. It was very beneficial. Do you recommend that for women in their 30s like I am?
Yeah, definitely. If you have any sort of family history, anybody in your family, aunts, moms, sisters, then certainly talk to your provider, and they can elicit more of a history to see if you are at increased risk and we need to screen you more closely or earlier.
And Dr. Cronin, before we let you go, any other message that you have for our viewers for October Breast Cancer Awareness Month? I know you were saying this is a really good opportunity to maybe reach some people who don't think about this throughout the year.
It is. If you're 40 and you haven't had a mammogram, or you've taken a pandemic break and haven't been back, it's really the best thing you can do to take care of yourself, to decrease your risk of dying from breast cancer, which we would hate. But go in, get screened. It's quick, it's easy, it's relatively painless. And if anything does happen, we have a really good team of people to take care of you at Atrium. So Don't be scared. We'll take good care of you.
And you sure will, and ultimately that's to help save lives. And so thank you so much for your time, Dr. Cronin, this morning. For everyone at home, we will have this